So today we'd like to talk about some of the key differences between TrueBeam technology and some of the other technologies that are available in Alaska. We would like to highlight some of the disease sites where we think that TrueBeam has an advantage. You'll hear from several members of my staff today. First from Heath Bonsall. Heath is a radiation therapist and dosimetrist, and I think that some unique experience that Heath brings to the table is that he's worked in all of the major oncology centers in Anchorage and really all across Alaska. So he really can highlight some of the key differences in the technologies and some of the capabilities that TrueBeam has and the TrueBeam planning platform that perhaps aren't possible with some of the other treatment platforms. One of the things that Heath will cover is breath hold technology for left-sided breast cancer treatments. This has been shown to be very important. In fact, in 2013, there was a New England Journal of Medicine study by Darby et al., which showed that for each 1 gray mean dose to the heart, there's a reduction in 7.4% for major coronary events later in life. I think you will understand after seeing some plans that Heath can review that with the reduction of up to 60% or more of dose to the heart, how that can be achieved with TrueBeam, and we know why that is important from that New England Journal of Medicine study. So you'll also have the opportunity to hear from Dr. Fred Harmon, who's a medical physicist at Alaska Cancer Treatment Center with an interest in radiosurgery. Now, much has been said about the difference between Gammaknife and TrueBeam technology for cranial metastases and for brain lesions. We know from multiple randomized studies that have allowed for linear accelerator-based stereotactic radiosurgery, Gammaknife, and even CyberKnife radiosurgery, that the comparison of cancer control in the brain, it doesn't matter which platform you use. What I would argue from a patient care standpoint is that there's really no reason anymore to screw a head frame into a patient's skull. Now, it's true that there's no cutting with Gammaknife. It doesn't require a blade. But it's actually worse than that. It requires screwing a head frame into a patient's skull. It's really an archaic technology compared to TrueBeam. So by comparison, Gammaknife takes a full day to deliver, or at least several hours. TrueBeam treatment can be delivered in between 2 and 5 minutes and requires no head frame. Lastly, comparing Gammaknife to TrueBeam technology, it's not possible to fractionate treatments. So typically not possible because patients don't want to have a head frame placed more than one time. With TrueBeam treatment, we can fractionate treatment. For instance, with acoustic neuroma, we know that there is a benefit in terms of hearing preservation when we deliver 5 treatments as opposed to 1 treatment. So we have that versatility with the TrueBeam. Dosimetrically, they're equivalent, if not superior, with a TrueBeam, and you can avoid a head frame.
One of the technologies that's integrated into the TrueBeam machine is the ability to real-time monitor the patient's breathing. So with left breast cancer, this becomes advantageous in the fact that we can have the patient hold their breath while the beam is on. And if you look at where the radiation dose goes, if we were just treating her without a breath hold, the beam would actually come right through one corner of the heart. With the patient holding her breath, we can actually still treat the entire breast and avoid the heart at the same time. And what this does is it reduces the long-term cardiac risk for the patient. This compares to the other cancer treatment centers in Alaska and the fact that they don't actually have this technology built into the machine. Whereas with the TrueBeam, it's all integrated, seamless, and we can actually trigger the machine to only turn on when the patient is taking a deep breath. So one other benefit of the TrueBeam technology is the fact that we have high definition leaves and we can treat in an arc. What this allows us to do is we can treat a large volume, boosting a small volume like this 1 centimeter lesion, and spare the hippocampus on a whole brain. Typically this is just treated with 2 beams coming in from one side and the other, and we radiate this entire volume to the same dose. But with this TrueBeam, we can actually sculpt a high dose region around a 1 centimeter lesion. At the same time, in the blue area here, we can reduce the dose to the hippocampus to about half the dose that we're treating the entire volume to. Studies have shown basically if we can spare the hippocampus when we're treating whole brain, we can basically preserve a lot of the memory function for the patient.
The TrueBeam provides all of the technology we need, from something as simple as palliative radiation to complex radiosurgery. This target here is irregular in shape and is located in the brain, and this is typically one of the more challenging cases to treat. With other technologies, for example the Gammaknife, you would have multiple isocenters and the treatment would probably take about an hour. With the TrueBeam, we're able to treat this with a single isocenter using the high-definition multi-leaf collimators and rapid arc technology to treat this in approximately 5 minutes. These red arcs indicate the path of the rapid arc treating the patient. So each of these typically takes less than a minute. So the imaging would be accomplished first. Then, and during the imaging, we'd actually be able to make use of the 3D capabilities. So we actually align a 3D cone beam at the same time, overlaying it on the 3D plan we have here. So we can align things up in 3 dimensions with high resolution, ensuring that we're targeting the correct area. And we also have a variety of beams we can choose from. Most technologies, for example, the Gammaknife and the Cyberknife, have a single, fairly low energy. We actually have 4 different beams we can choose from. So depending on the size of the patient or the depth of the tumor, we're able to optimize the beam for that treatment. One thing I wanted to emphasize regarding the multi-leaf collimators is that it gives us the capability of treating not only an irregular shaped target, but multiple targets, all within one plan, rather than having multiple plans for each target, which can, again, dramatically increase the speed of the treatment, which makes it much easier for the patient. And we also can treat the patient in multiple sessions, since we don't have to bolt a head frame to their skull, which is quite inconvenient and painful for many patients.
So one of the disease sites that really lends itself well to TrueBeam technology, and something that we treat a lot of at Alaska Cancer Treatment Center, is prostate cancer. Now, a giant leap forward in the world of radiation oncology was IMRT. Well, the leap beyond that has really happened in the last few years, and that's rapid arc. So the ability to be able to deliver an IMRT type plan, but in 2 minutes, and with utilization of flattening filter-free technology, rapid arc, and daily imaging, you really get amazing looking plans in terms of prostate cancer. So one of the benefits in terms of daily imaging is the utilization of daily cone beam CT. So this gives us not just 2-dimensional images, not just lining up to gold fiducial markers that are placed into the prostate, but we can also track the daily bladder and rectal volumes and line up accordingly. There are times where, for instance, a patient might have a less full bladder than we might like, and we'll pick that up on a cone beam where we wouldn't see that on plain films. So we can ask them to drink more water, actually get them off the table, have them drink more before we proceed with the treatment. One way to be able to assess the quality of a radiation plan is by looking at what's called the QUANTEC dose constraints. So these are validated normal tissue constraints that have been justified in the available body of the literature that tell us exactly what doses each normal tissue can tolerate in terms of radiation dose. So when you're looking at one radiation plan versus another, you want to look, number one, what dose of radiation is being prescribed. We know that for prostate cancer, there's a benefit to dose escalation. So we treat to 81 gray, and yet we are able to meet the QUANTEC dose constraints on normal tissue.